This program is designed to provide general information with regards to the subject matters covered. This information is given with the understanding that neither the hosts, guests, sponsors, or station are engaged in rendering any specific and personal, medical, financial, legal, counseling, professional service, or any advice. You should seek the services of competent professionals before applying or trying any suggested ideas. Attention individuals, families, and caregivers. It's Medicare Hour and More with Peter right here on K4HD Radio. This is the podcast for all types of insurance solutions while specializing in Medicare because we Medicare. Here's your host, Peter R. Joseph.
Good morning, good morning, good morning. I'm so glad to see all of you guys. It is episode 5 of our radio show. I can't believe we're already in April. It's crazy. This time is just flying by. Hope you had all a wonderful, wonderful Easter and spring break for those of you who have kids and families. And yeah, our family actually went out to Disneyland for a couple days. It was very crowded. I'm not sure. It used to be so fun, and now it's overcrowded. It was definitely hot, and a lot of the rides broke down. So it wasn't the greatest experience, but my kids had a good time, so that's all that matters. But anyways, we've got a great show today. We've got a special guest. Her name is Misty Bolt. She's a CEO of MedicareMisty. So we'll see her in a few minutes here. But we will continue on our conversation, breaking down Medicare for you guys, making it simple. We've covered Medicare Parts A, B, C, and D. We've covered the different enrollment periods for Medicare, when you're supposed to sign up, how you're supposed to sign up. So hopefully you caught all those tidbits of knowledge and information, and it's been helpful, and you've been able to apply it to yourselves. We are going to dive more into Medicare Part C. We did start talking about it a little bit this last week. We're going to continue talking about that today if we have time. And then we'll have our great interview and conversation with Misty talking about the Medicare trends and things happening in this space that might be concerning and might be needing some of our attention. There's definitely going to be some more disruption for this next year with Medicare again, unfortunately. And so, this is kind of the time where plans are starting to shut down. PPOs aren't as prevalent, and benefits are getting cut, unfortunately, left and right. That doesn't mean there's ways around that. We're going to talk about how to navigate all of that. So, all right. So let's dive into Medicare Part C, and then we'll wait until Misty comes on board, and then we'll jump into our interview with her. So we had talked about how Part C is the Medicare Advantage plan space. And so that is where it includes your Part A, B, and then D as in dog for your prescriptions. It's all in one versus, remember, Medicare Supplement we talked about was like an a la carte system. So you have to figure out also budget-wise. Medicare Advantage usually doesn't cost anything extra. However, Medicare Supplement does have an extra premium. So budget-wise, you have to figure out what is best for you and what you can afford. So that's why a lot of folks do go the route of Medicare Part C, because there is no extra premium that you have to pay. And it also includes your extra benefits, usually of dental, vision, hearing, over-the-counter allowance, transportation, all those necessities that you might want. That's not going to be included in a Medicare Supplement. And so that's kind of the key that we want to focus in on. The bad thing about Medicare Advantage is that you are stuck in a HMO network. There are PPO plans, not as many as there used to be, but you are, in a network. There is coordinated care. That's the strong suit. But with a Medicare Supplement plan, you're able to see whatever doctor you want without any authorization. With the HMO plan, you have to usually go through your primary care doctor to see a specialist. So that's the big difference. And so people like to have that freedom, but you pay for what you get, right? So we're going to continue talking about the different extra benefits that there are, though. So like I said, there's vision, hearing, gym membership. Gym membership is included also on the supplement side. Over-the-counter allowance. It just ranges from plan to plan. Sometimes it's about $25 a quarter. Sometimes it goes up to $100 a quarter. It just depends on the plan. But you can use that for the pharmacy section. Anything that's in there, like Band-Aids, vitamins, supplements, most carriers will send you a catalog of what you can get. Transportation, usually it's coordinated through Uber or Lyft. Some carriers do have their own services as well. And then meal programs after hospital stays or surgical procedures. So those are the extra benefits. And then again, we said it does include prescription Part D. And then the coordinated care. It's especially strong with HMOs. Doctors communicate within the network. So you've got that advantage as well on the Medicare Advantage side. So the difference again with HMO is you can stay in network. PPO, you can go in or out of network. But like I said earlier, PPOs are not as prevalent. There's not a lot of choices out there, especially in Southern California. It hasn't been beneficial for the insurance carriers, and that's why a lot of them have shut them down. So just keep that in mind. And then we briefly talked about special needs plans. Those are for chronic conditions like diabetes, heart conditions, lung conditions like COPD. So those plans are adapted to those chronic illnesses, and it's just more coordination, better coordination for those illnesses. So that's why you want to be on those plans, especially with the prescription drugs that you would be taking if you're on one of those illnesses. All right. So the key benefits of Medicare Advantage, you've got lower monthly premiums. Like I said, a lot of them are $0, especially out here in California. The maximum out of pocket that you would spend, remember, that's different from a deductible. So maximum out of pocket here in California, I mean, it's low. It's about $200 to $800 max on most plans out here. And that's the most you would ever spend, God forbid, if something happens to you, cancer, chemotherapy, those kind of things. So that's the most you would pay out of pocket. You do have to always pay your Part B premium. That's never going to go away. A lot of my clients think, oh, I'm on Medicare, it's free. It's not free. Medicare Part B, you're paying a premium right now. It's about $202 for most folks per month, $202. And we do pay into Medicare, but we pay into it so that we keep the premiums low. It's not so that we can have Medicare for free. So just keep that in mind. Medicare is not free. Again, the maximum out-of-pocket protection, once you reach it, the plan that you're on for Medicare Advantage pays 100%. And then, you've got those extra benefits as well. Now, let's evaluate real quick the prior authorization process, because there are potential interventions to reduce unnecessary initial denials. That's what a lot of people are scared of when they go on Medicare Advantage. They feel like they're not going to get approved for procedures. They're not going to be able to see certain doctors because they're not in network, and they're afraid that their claims will be denied. So I will tell you from my experience, a lot of my clients are happy with the carriers that they're on because of my experience. I know which ones work well with each other, which ones have a quick turnaround for authorizations. So you have to get with an agent like myself that's specially knowledgeable about the carriers and their procedures. Okay. So there's instances where the provider orders imaging, and then there's a prior authorization required. Okay. And then it's either approved or denied. If it's approved, the imaging's performed, and then you go see your doctor, or you go over your results. If it's denied, It's called what's a peer-to-peer required. There is an appeal process, but a lot of times, if you're seeing your primary care doctor pretty often, these cases aren't going to be denied. You just want to assess documentation patterns for opportunities to reduce risk for denial. Okay. Your doctors are pretty knowledgeable about how to navigate that system as well. You want to streamline the workflow, ensure the doctors are putting in the right reasons for you getting that imaging or those tests. And if they're connected to, something that you've been diagnosed with, that's a greater chance of that being approved. So just keep that process in mind. Now, the generosity of Medicare Advantage compared to just traditional Medicare, there's a difference between the monthly out-of-pocket costs in traditional Medicare versus Medicare Advantage. So if you're just on original Medicare, let's say, you sign up, you turn 65, you're just on Medicare, and you pick up a Part D for your prescription drug coverage, there is no ceiling to the max out-of-pocket costs when you're on original Medicare. That's why folks get onto a private plan through Medicare Advantage or through Medicare Supplement, is to mitigate those costs and make sure that there is a ceiling. So again, keep that in mind, that there is no ceiling if you're just on original Medicare. They pay 80%, and then you're responsible for 20% of the total cost. So, if you've got a bill for $100,000, you're going to owe $20,000 on that bill. All right. So just keep that in mind. Again, here's the other pitfalls versus original Medicare and Medicare supplements. If you're on a Medicare Advantage, again, you're not covered outside a network unless it's an emergency through urgent care or through an emergency room facility. Otherwise, you cannot go outside a network for your specialist, for any doctors, ongoing treatment, cancer care continuity. All those have to be in network. All right. So there are network restrictions. That's a big issue when clients move or travel, especially if you have family in other states and you want to stay there, let's say for 6 months out of the year. My suggestion would be to go on a Medicare supplement versus Medicare Advantage. That way you're able to see other doctors in other states. So that's a reason to go the route of a Medicare supplement over a Medicare Advantage. Again, there's prior authorizations. So, many services require approval. MRIs require approval. Surgeries require approval. Certain medications require prior authorization. And then sometimes, folks will run into delays in care, which is a major frustration point. The wait times across the board right now, our health sector is very impacted and understaffed. And so we're hearing stories of people not able to see their primary care doctors for 3 or 4 months at a time. They'll call in and they can't get an appointment until 3 months ahead of time. So that is a concern. And so another way around that is to try to get on a supplement plan, see another doctor as an alternative, and get in to see that doctor quicker. So again, though, there is an extra cost to a Medicare supplement. The other thing that happens is plan changes every year. So benefits, networks, formularies change annually. Doctors and hospitals can be dropped. Plans exit and enter the market. And so there's frustrations on that part. That's why we review with our clients our Medicare Advantage plans every year to make sure, the benefits are staying the same, if they're increasing or decreasing, their doctors are still staying in network. And if they don't, or there's issues with certain prescriptions, then we have to navigate and figure out a different carrier that a client has to be with. And that annual enrollment period, again, is every year, October through December. So yeah, there is a headache about doing stuff like that. I'm going to stop there, see if Misty is with us or not. I don't know if she's hopped on. Hopefully she has. All right. Well, I'm going to at least do an intro for her Nope, she's not on yet. Okay. So I'm going to just share real quick about Misty. Maybe by the time I finish this, she will come on. If not, that's okay. So Misty Bolt is the founder of MedicareMisty. She has over 25 years experience in the insurance industry. Her focus is navigating the Medicare Maze, including original Medicare, Medicare Advantage, Medigap, and Part D prescription drug plans. Her services are enrollment assistance, plan comparisons, educational events like insurance boot camps. She is located on the East Coast. She is in Tennessee. So she primarily works out on the East Coast, but she does, she is licensed in 45 states in Puerto Rico. She does have 55 agents under her belt. How did I meet Misty? Well, we met actually through social media. So social media is a powerful tool, obviously, where we can meet our colleagues and peers in this industry. And so that's how Misty and I have met. I've known Misty for quite a while. She authored the book Navigating the Medicare Maze with MedicareMisty. You could probably find that book on Amazon. Again, that book is called Navigating the Medicare Maze with MedicareMisty. And that was to help provide guidance on healthcare options. She also authored a children's book that comes out this May. So be on the lookout for that. She has her own business. She's hosted a talk show, runs her own magazine, wrote her own jingle, wrote her own wine. Wow, that's pretty cool. So Misty's got a lot of experience in a lot of different fields. We're excited to have her on later on in the show. So we'll just continue to hold on and wait for her to come on. And so in the meantime, what I'm going to do is break for our first commercial. This commercial will kind of explain why you would trust Joseph Insurance Broker with your needs.
Is the fact that Medicare doesn't kick in until 65, but I probably don't want to wait until I'm 65 to learn about it. Let me know when people should contact you to start talking, to start preparing, to make sure they're doing everything properly.
Well, Brian, I've got some prospects that are 63 years old, and they're working with me now. And so it's important to navigate. There's so much out there, so much information, and you don't want to wait till the last minute. With Medicare, you do have to contact Social Security office 90 days prior to your birth date when you turn 65. And I recommend my clients to get on the page when they're 63, honestly, so that they can understand what's out there. They can start comparing plans and get ready for whatever is coming next, whether it's the retirement age or there are some of my clients who are still working and are eligible for Medicare, and they don't realize that they can save money by switching over to Medicare and still working. So that's an important concept for people to realize.
All right. So again, that was another interview with Biz TV when I first started out. A lot of people last week saw my show and said, "Whoa, that's you?" Yeah. I lost again 141 pounds over about 8.5 years. I will share my tricks next episode, but yes, they asked me to be interviewed because of the successes we had. And so that video shows when you should get with an advisor like myself. You don't wait until you're 65. You want to do it when you're 64 years old and you start planning ahead. Obviously, you can get onto Medicare 3 months prior to your 65th birthday. So at that point, you want to be with an agent. You want to start looking at your options. Medicare can be very confusing. You want to be able to navigate that Medicare maze with someone who's trustworthy, who's knowledgeable about this space. So again, we are live on Facebook and YouTube. So our YouTube channel is Medicare Minute with Peter. It's at Medicare Minute with Peter. So you can find us there. Our Facebook Live, we're Joseph Insurance Broker LLC. We're also live on my personal page, Peter R. Joseph. So look for that. You can always respond, put comments, ask questions. You can also call us and text us, and we'll respond on the show. Our number is 909-217-2630. So please, if you have any questions or comments or feedback, please respond, and we will respond back accordingly. All right. So while we're waiting for Misty here, we are going to continue on with Part C and the pitfalls of Medicare Advantage Part C. So we talked about how many services require approval, right? Well, and then we talked about how plan changes every year, and we have to be on our toes and really look on every annual enrollment period and make sure that we're on the best plan every year. You're not ever married to your plan, so you can change plans, and I highly recommend that you're always reviewing your plans with your Medicare advisor. Now, the higher cost if you get sick, that's another pitfall. It's a pay-as-you-go model. So, you know, there's copays, there are coinsurance. It can add up quickly with a serious illness. Again, though, you know, in California, it's not as urgent because, again, we had talked about how those Medicare out-of-pocket costs are so low. And so you would not run into that situation, even if you're going to see doctors constantly. You know, if you reach, let's say, that Medicare out-of-pocket max of $299, once you reach that, your insurance pays out 100% on everything. So those payments or those fees aren't going to accrue as quickly out here in California because our out-of-pocket is so low. There are geographic limitations too. Plans are county-based. There are carriers that allow you to cross county lines. So again, you want to get with an advisor to know, you know, the rules and regulations on that. You know, but if you move out of a county, you're going to have to find a new plan. So your plan doesn't travel with you. With a Medicare supplement, that plan does travel with you. So that's a big difference, okay? Switching can be harder later. So let's say you want to try a Medicare supplement. I would recommend you do that when you do turn 65 or you're first eligible for Medicare. Why? Because you're guaranteed in without any underwriting or prior authorizations or you know, pre-existing conditions, anything like that. You're automatically in. Now, if you go on a Medicare Advantage and then you decide 2 years later, oh, I'm going to try a Medicare supplement, it's not as easy to get on. You actually have to go through underwriting. They're going to pull your medical records. You could be denied if you have cancer in the family, if you have diabetes, if you have any serious illnesses at the time of your application. So really, if you want to try a Medicare supplement, the best time to try it is when you're first eligible for Medicare. All right. And most agents don't explain that fact. So I'm explaining it now. You know, ding, 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 big alarm right now is going on. It should be in your head. If I want to try Medicare supplement, you try it first at bat. All right. You try it when you turn 65 or you're eligible for Medicare. All right. So let's quickly talk about your enrollment periods for Part C. Again, what's the biggest mistake our clients have? Oh, that is Misty right there. Give me 1 second, guys. Hi, this is Peter.
Hey, it's Misty. I have us down for 12:15 my time.
Yes, so I actually sent you a link. Did you check your spam email?
I'm on Zoom. Is there
No, yeah, it's a different link for the studio.
Okay, let's see. When did you send it?
I sent it last night.
No, I got nothing from you, so let me check junk. But I've already gotten your email before, so I don't know why.
Yeah, sometimes our business email goes to spam. Let me see. I can resend it to you from a different email address and see if that works.
I'm going to junk. I think I have spam, not junk. Let me see.
All right. All right, let me see if you get that one. I just sent one from a different email address.
Okay.
All right, guys, hold on tight. Misty is on the
From
phone.
Peter, does it say Peter? Why don't I just search the email address it's coming from?
Okay, so I've got, it should be either from Peter at josephinsurancebroker.com. The other one would be Pepster0824 at Yahoo. That's my personal.
Pepster?
Yeah, that's my personal.
How do you spell Pepster?
Pepster.
Pepster at what?
Pepster0824 at yahoo.com.
No, none of those are coming up.
All right, that's so weird.
Okay, here we go. Okay. Medicare and more. Here's a link to connect. Okay. Stream on. Okay.
Oh, perfect. Okay, so you're going to put your name in as you want it displayed, as well as your insurance business name, and then we'll hop you in.
Okay, thank you.
Thank you.
All right, bye.
Bye-bye. All right, sorry about that, guys. Just had a little technical glitch, but she is about to jump on here, so we're going to stop right there and try to get her on. All right. Hey, Misty, how are you?
Wonderful. How are you?
Awesome. Good.
Yay.
I'm glad you came on. I was like
know.
waiting for you, and I'm like, oh man, I don't know if I sent you the right link.
I know.
It's all good.
And I
It's all
was
good.
like, oh, we got it.
It's happening to a lot of my clients lately. I don't know why my email is just going to spam for people. So I need to figure out how to fix that for you guys. So anyways, Misty, I already introduced you. We talked about a little bit. You have 25 years experience. Is that in insurance overall or Medicare as well?
I've had my license for 26 years, and I was doing long-term care and disability quotes. I was like an account rep. And then in 2005 is when I got into Medicare.
Okay, awesome.
Yeah.
And where are you located at?
Chattanooga, Tennessee.
Okay, and you're licensed in 45 states?
And Puerto Rico.
And you've got 55 agents under you?
Yes.
That's awesome. That is awesome.
Insane.
Yeah, I bet. You're a busy bee. All right. So how did it all start? How did you get into Medicare? What made you passionate about it?
Well, I always say it was Jesus, because I was interviewing for pharmaceutical rep. All my friends had pharmaceutical rep, and I was single at the time. They got a car, they got a gas card, they got commissions. And so I had interviewed 25 times and nobody hired me. And this lady came in, she said, hey, do you want to do Medicare? And I go, what's Medicare? She's like, you don't know what Medicare is? I'm like, no. Because when we get a job, our first job, nobody sits down and tells you what FICA is. You pay all this money and you don't even know who's taking money out of your check. I mean, it's absolutely insane. So she was like, okay. She explained everything. What is Medicare? What is A? We're paying for A right now. As long as we work 10 years, 40 quarters. And she's like, don't worry about it. I'll teach you everything you need to know. They're going to love you. And they did. I mean, it's like she said, it's like them, you being their grandchild. And then at first I thought, oh, maybe they won't think that I'm smart enough or, they could trust me. But when I realized it's a niche field, not a lot of people understand it. And nobody was doing it in my area. And it was totally a God thing, because I didn't even know what Medicare was when this lady came to say, hey, you want to do Medicare. So I always give him the glory, because if it wasn't for him, he wouldn't have put that in my path, because I had no idea what Medicare was.
That's awesome. That's awesome. Well, so, you've been in this space for such a long time. Do you see any big trends coming up this year in the Medicare space that we should be aware of?
Well, the whole non-commission things we're all scared about. And I was here when they did it with ACA, and that was scary. Now, I wasn't as big into ACA as I was Medicare. I would do it if a client came in and had a spouse that wasn't old enough, but I wasn't promoting it. So it really didn't hurt me to say I'm not going to do this anymore. but when it comes to them not paying commissions in Medicare, that would hurt me. And so I'm hoping it's not going to become a trend. We're fighting really hard. HOFA is a big, if you're not part of HOFA, please join HOFA.
For
NABIP,
sure.
they're all fighting for us to keep commission. I've called Trump Malargo, I don't know how many times, to be like, look, they're trying not to pay us. Please help and set them straight. And we're on a quarterly call with Medicare, with CMS, trying to, with HOFA, going to Washington, to fight for our career. I keep telling our agents, get letters of what we do. We're not just agents. We help, get them prescriptions. We help them get a food card. We help them get their Medicare premium paid for. We help them get Medicaid.
Sure.
I mean, all the things that we do that isn't even in, our job description to do. I mean, we're just more than a glorified agent giving them a product on top of all the testing we have to take.
Yeah,
it's
exactly.
Doesn't have to take it. They got one certification, that's it. Ship. They're not even licensed. I mean, how is that? You put all these regs on us, but then SHIP can come out and take a test and not even be licensed to do this. Just blows my mind,
Well, I saw the final rule just dropped. I'm hoping that it goes through, because that 48-hour rule is going to go away, which is huge. Yes. My clients get confused left and right. I mean, they're like, why do we have to wait that long to talk about stuff, right? I mean, it just doesn't make sense.
It's the silliest rule ever.
It is.
I like the whole idea of giving them a PIN.
Yeah.
Here's the PIN number. The PIN number ties it to the agent, which the app ties it to the agent, So if a complaint comes in, it ties it to the agent, and then say, hey, where's the recording? Where's the documentation? I mean, waiting 48 hours and having the documentation, the point is you just need the documentation saying we've gotten permission. I'm okay with that. To me makes sense, saying, okay, here's the scope saying you did give me permission to talk to you.
For sure. All right. So I'm gonna stop there real quick. What is your what's your phone number and your web address, so we can put that on so people can reach out to you?
Sure. MedicareMisty.com.
Okay.
And 423-240-0794.
Perfect. All right. So our audience consists both of agents and clientele and prospects. So what would you say to our clients, our prospects, is the biggest mistake beneficiaries make when they're starting their Medicare process?
I think some wait to the last minute, and I think that can hurt them by waiting till the last minute. Do your research. There's so much research out there, so that, a lot of people, when they come in, they want to know a little bit before they start, digging into it. So it kind of gives them a little bit of leverage to.
Oh, we lost Misty there. All right, well, hold on for a second here. We just lost her video and her audio. Misty, can you hear me? All right, let me text her. Oh, what a show. These things happen. It's technology. All right, let me see. Hopefully it's just her internet is just down and she can restart. All right, so while we're waiting for her to come back on, I was going to ask her the differences between Advantage and Supplement, since we weren't talking about that earlier. I think she would have great information on that as well. Again, she covers 45 states. A reason we bring her on is because we work together. I trust her inherently. Obviously, our broadcast is to the West Coast, California, Arizona, Nevada, all these states out here. I would recommend, if you're moving to the East Coast or you're listening in and you live out in the East Coast, go ahead and reach out to Misty rather than us. She would more than happy to help you guys out. There's so much business out there, and we want to help as many folks as we can with this craziness in the Medicare space. So that's why, we bring colleagues on like this, so that we can help you guys through all this. All right, so I'm going to continue on Medicare Part C until she comes on. Otherwise, we do have a second commercial too. I'm going to wait on that though. Oh, hey, there you are.
Hey, low battery.
Oh no. Okay. Hey, no worries. No worries. We
Every
got you. We got
time.
you.
That means we talk too much, right?
Yeah, no, exactly. Exactly.
Okay.
All right. So I was going to ask you, what would you tell folks is a big difference between Medicare Advantage and Medicare Supplement?
That is a great question. So the Advantage plans have more benefits, is what I always say. They have more benefits versus the supplement that has more coverage. So you get dental, vision, hearing with Advantage plans, and over the counter, a food card. I got kicked out of my room, so
Oh my goodness. All right.
um, Advantage plans, so they have more benefits like that. Supplements have more coverage. They go up, most of the time either by age or by year. And you have to buy the drug plan. The drug plan is not included where it's included on the Advantage plan. There's a network tied to Advantage plans. So the biggest thing is the networks that I hear. You have more freedom, with the supplements, unless you do a PPO area, but they still have
Right.
to accept to build a PPO.
Okay. No, that's great information. And then how would someone trust, or how would you know an agent is compliant? What are things to look for a client to find the right agent?
See how long they've been in the field. It's like when you go to have knee surgery or elbow surgery or eye surgery, you don't want someone that's brand new, that doesn't have the experience to give you the benefits that you deserve. Also to know the lingo. It's just, you want an experienced rep that's been in the field and won't stir you wrong.
For sure, for sure. And your business clearly reflects relationship building and education. How important is that in this industry?
It's very important. And, we take about 32 tests a year make sure that we know this information. We have to make a 90 on most of them to make sure that we know this information. And so we're constantly staying in front of it, and constantly reading CMS websites, reading any kind of that has to do with our field, especially now with the changes coming up.
Yeah, for sure. And then, we talked about how you've got 55 agents under you. So how do you balance scaling your reach while keeping your personal touch?
So you have to build a team underneath you because you'll get burned out. I did that until the last 4 years. I burned the candle at both ends, and it wasn't helping me. It wasn't helping my team. Get a pay, because I think that's every, agencies is like, oh, that's a lot of money to shell out. But then once you shell out that money, that's going to release you doing other things. It's going to allow you to make more money in the field of you not doing the things that you shouldn't be doing anyway. My biggest thing was learning to work on the business, not in the business.
For sure, for sure. That's awesome. All right. So I'm going to do a quick rapid fire. These are kind of fun questions.
Okay.
A lot of them are one word answers, but go ahead and answer to the best of your ability. So one word to describe today's Medicare market. One word.
Crazy.
Yep, that's a good one. All right. What's the biggest myth about Medicare?
That it pays for long-term care nursing home.
Amen. Yeah, a lot of my clients always think that, right? And they find out
Yes.
the hard way. All right.
Yes.
What is the most underrated opportunity for agents right now?
I think everywhere there's opportunity, we don't realize it. I believe that everywhere we go, God puts us in a place where there's a time. Everybody around me, I feel like there's an opportunity. If we don't say hi, how you doing? I think we miss that opportunity. And you know, people would say, "Oh, it's saturated. The market's saturated." It's not saturated. There's several people that have not, you know, been to a certain dentist, have not been to an eye doctor. I mean, you know, in the where I live in Chattanooga, they're like, you know, you're hiring so many agents, and it's like we haven't even hit all the financial advisors yet, all the
Yeah,
PNC
yeah.
people yet. So there's opportunity everywhere. Just open your mouth and say hi. How you
Yep.
doing? Love your shirt. Where'd you get
Awesome.
it?
All right. Social media or referrals, which wins most long term?
Referrals always.
Yeah,
That means you have trust, and people trust, you know, they're trusting that person to trust you. So
for sure.
always referrals beat over that. I think both together is, you know, a powerhouse.
Awesome. All right. If you had to restart your career today, what's your first move?
I would probably do more LOAs.
Okay. Awesome.
Yeah.
Awesome. All right. And then one daily habit that's made you successful.
Consistency. Every
All right.
day I'm working this business, every minute. Even my husband's like, "Are we gonna have to do that today? Can you put it on the burner?" And I'm like, "Okay, 5 minutes. We're gonna table it."
Yeah, 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 for sure, for sure. And then what do you like to do on your off time? What do you enjoy doing?
I love traveling. I really do. I love Jesus and I love traveling. So we're going to Budapest in July,
Oh, wow.
Alaska in August. Yeah. And then
That's
I'm
amazing.
speaking in a different state. Like I'll be in Houston this month. And so several different states the rest of the year.
Okay, okay. Very cool. Well, safe travels to you. That's
Thank you.
exciting.
Very.
All right. So here's our last question for you today.
Okay.
If you want to make smarter decisions in today's Medicare landscape, what's the one thing they should focus on?
Marketing and network, really.
All right. All right.
Constantly, if you're not selling, you should be marketing and you should be networking. Your network is your net worth.
Awesome. And then where can people find you on socials? What's
Medicare Misty on everything.
okay. There you
Real
go.
easy.
And there's Medicare Misty's website, MedicareMisty.com. Her phone number to direct is 423-240-0794. We will have your information, Misty, on Facebook Live, YouTube, as well as our website and podcasts. You can catch this podcast on Apple Podcasts in a few days as well. Misty, thank you so much for taking the time to be on our show today. We appreciate you so much and all that you're doing for our clients.
Appreciate you, Peter. Appreciate the collaboration and sorry about the technical difficulties.
Hey, it happens. Don't worry. All right, take care.
Okay, you too.
All right, bye-bye.
Bye.
All right, that was a great interview. Sorry about the technical difficulties, but that's our interview with Misty. We are going to end our segment here with our second commercial, and then I'll come back on quickly.
Hi, Peter.
Hey, Christine, how are you?
I'm good. How are you?
I'm good. It's going well. It's my birthday today, so I'm kind of celebrating a couple of things, but I've had some great conversations with some clients this morning, so it's been a good day.
Sounds good. Happy birthday. And I see that your kids made you breakfast this morning.
They did. That was an exciting surprise this morning.
That's so cool. Well, thank you for joining me today in this interview, because I've had so many people reaching out to me about Medicare and what to expect, and they're lost. And perfect, because I know you, and I know that you'd be the perfect person to talk to. So I just want to thank you for joining me today.
Of course.
Let me share a little bit about Peter to the group. Peter is an Egyptian American and has been married for 17 years to his beautiful wife, Bonnie. She is a supervisory social worker for the state of California. They have two amazing kids, Noah Liam, age 5, and Julia Grace, age 10. He was in the nonprofit sector and a pastor for 22 years. He then transitioned into the insurance industry for 3 years. Peter's family was featured in a local magazine in February of 2020, Neighbors of West Chino Hills, for the business they work and the impact in their community. He was also featured on Biz TV, Los Angeles, for an interview about Medicare. He is also an ambassador for Chino Valley Chamber of Commerce since February of 2019 and a member of the BNI Chino Valley Strategic Alliance Group. Peter is looking out for the best interests of seniors. He has no bias toward any carriers. Peter works with all the top star rated plans. He's contracted with SCAN, United Healthcare, Anthem, Humana, HealthNet, Blue Shield, Aetna, Silver Scripts, and Molina. Peter can help with Medicare Medi-Cal plans, Medicare supplement plans, Part D plans, as well as low income help for Part D. So I do have some questions for you, Peter.
Okay.
Let's jump right into it. Why did you decide to go into Medicare?
So for those who don't know me, I was in the nonprofit sector for about 22 years and just have a servant's heart. I love helping people out. And so I felt like after I left the nonprofit sector, I felt like this was a great place to go for my skill set in helping people kind of navigate the Medicare journey. And like I said, I love helping people. I'm all about educating and giving free consultations.
Awesome. Now, how old do I have to be to start thinking about Medicare, and why?
Well, honestly, you know, people say you should wait until you turn 65, but I do have some prospects that I work with who are 63. So I would say if you're turning 63, you need to start thinking about it because there's so much out there. There's so much terminology and it gets kind of confusing. So it's important to start planning ahead. And so I can work with you. And then when we turn 65, we can get you on the right plan.
Good to know. Now, how does one?
All right, so we're gonna finish that interview next episode. We are kind of slowly running out of time with our technical difficulties today with Misty, but we're so glad that you joined us today for our show. Again, you know, I'm going to just do a quick summary. We were talking about Medicare Advantage Part C. Misty even alluded to, you know, what the advantages are to Medicare Advantage versus a Medicare supplement and vice versa. Again, you want to be with someone who's been in this industry for quite a while, a trusted advisor that can walk you through all that and make sure that you are making the right moves in the Medicare space. Medicare Advantage is tied to a network. There are disadvantages, like we said, about denials, not getting approvals, delay of care, those kind of things. The advantage, though, is it includes everything like dental, vision, hearing, over-the-counter, gym membership, prescription drug plan. So you're not doing everything a la carte. You're not spending extra premium dollars because the Medicare Advantage is normally $0 premium. So those are the things that you want to key in on and focus on. We do bring on quite a few folks that are in this industry that are knowledgeable. We also have brought on, and we will continue to bring on, small businesses that we work with and trust inherently, because here at Joseph Insurance Broker, we want to put those small businesses with a spotlight on them to show you guys that there are so many resources out there for you in this community that you can use and apply to your own lives. We hope these interviews have been helpful to you. We hope that you're able to apply these nuggets of information to your processes. And we work hand in hand with all these spheres, right? Insurance, you know, works with everything. You know, our life insurance, we work with health insurance, small business group benefits. All those things are important and they all intertwine. And so that's why this show is more than just about Medicare. Thank you again for joining us this morning. And just to let you know, our tagline is We Medicare.
Thanks for listening. Tune into Medicare Hour and More with Peter every Tuesday at 9 a.m. Pacific Time right here on K4HD Radio at K4HD.com for more real-life stories from experts who Medicare about you and protecting your health, your finances, and your future. See you next week.